This climber, who presented 3 months after a fall on an outstretched arm. X-rays were negative for fracture, and she had 4 out of 10 resting pain through the entire hand. With objective testing, pain was with active and passive range of motion into flexion and extension of the wrist at 15 degrees. There was a 7-degree temperature difference in the hand. The left was 93 degrees and the right was 86 degrees. And there was a positive centralized pain mirror provocation test. So all of these factors combined that she had a likely diagnosis of complex regional pain syndrome in her hand, and she was unable to climb. So based on this information, how do we develop an intervention program? Well, there's a step-by-step process that has been supported by literature and research that goes through a concept of graded motor imagery. And you don't have to apply this just to this patient. These concepts can be used and filtered with climbers of all different levels, of all different amounts of pain, but their pain is mostly biased into one region of the body. And in this case, pain in the entire hand. So we're going to take the climber through these 3 different steps. Let's now watch a mock demonstration of how you can test laterality or left-right discrimination for a rock climber who has hand pain. The climber will download the Recognize app. They'll load that on their device and begin the testing process. They'll hit start. On the screen, they'll see various images of hands in different positions. They'll need to identify whether the image shows a left hand or a right hand. They will click the left button or the right button to indicate their best guess. Climbers who are unable to accurately identify their affected hand may have a deficit in left-right discrimination. And this app can be used as an assessment tool to determine the accuracy as well as the time that a climber takes to identify the correct response. This is the first step in the treatment process of a climber who has centralized pain, this left-right discrimination. The second step is this explicit motor imagery. This is where the climber imagines movements. And I want you to think about this. Imagine this climber that we talked about with hand pain. And every time that they think about grabbing a rock hold, their hand starts to hurt. They don't grab the hold, they just think about it. So you can use explicit motor imagery or imagined movements to start to habituate the central nervous system into the thought and the feeling and the sensation of gripping with the hand without actually doing it. And this desensitization or this habituation of the nervous system can prepare the climber to eventually get back on the rock wall. So this is the second stage. This is imagined movements or this explicit motor imagery. Now the third stage of graded motor imagery, this is mirror therapy. And you can use a mirror to retrain the stimulus and sensation of the climber gripping with their affected hand. You can see in this mock situation that the climber has their right hand, their non-affected hand facing the mirror. As they look or peer into the mirror, they can see a reflection of their right hand, and it appears as though it is their left hand. So their brain is tricked into perceiving that the image that they see in the mirror is really their left hand. And there's many different ways that you can harness and utilize mirror therapy to progress and habituate a climber into moving their affected limb in their mind, and then eventually moving the actual limb.